This is a case of glaucoma post-filtering surgery. So let us see how to manage such a case. The first thing is to avoid touching conjunctiva, especially the area near the bleb at all the times. Now, second thing would be to avoid pressure fluctuations. सर आपको कोई दर्द होने का मतलब ही नहीं है, आँख आपका सुना है. So लाइट में देखते रहिए. So now the trick being, we have to avoid pressure fluctuations and over pressurizing the eye. We make a decent size rhexis, capsule rhexis in this case. Now we make slightly larger side port because we want the side port to act like a wall, and make sure that the fluid can escape from there. Do a cortical cleaving hydrodissection. Make sure that we have a good hydrodissection. The nucleus is rotating freely. I prefer rotating the nucleus 2-3 times because it makes my irrigation aspiration. Bottle light IOP 35. Now you would want to have a slightly lower IOP and a lower vacuum. Vac 310. So from a vac of 330, 340, I have reduced the vacuum to 310, reduce the bottle height because I want to operate under a low bottle height. Now we will observe a few things. We keep the vacuum on for most part of the surgery because we don't want the IOP to go up. And we will be demonstrating a peripheral or a horizontal chalk. Embed the phaco tip, go in front, come from the periphery, embed and separate. So there, now we will be demonstrating the D-flip technique. In D-flip, you just hold 1/3 junction of the mid-meat of the nucleus, hold it and pull it out of your capsule rhexis, and then start your emulsification. So this makes the process both fast, efficient, and you will notice I would not want to be in an occlusion mode for a long time because the moment you are occluded, the IOP tends to go up. So the moment I am occluded, I start my phaco and I ensure that the break of occlusion is happening in between. I push the nucleus away, off and on in between, so that there is no constant occlusion. There, the surgery is over. लाइट को देखेंगे सर.
शाम पे आरे कीजिए.
सर्जरी हो गया है सर आपका. नाउ अगेन while doing irrigation aspiration, bottle light again reduce. Now notice we have not touched the conjunctiva at any point of time, and especially near the filtering bleb. Now I will dip my side port. If you notice, I have dipped the side port to continuously regulate the intraocular pressure because the fluid inflow during irrigation aspiration is a little higher. ऐसे नहीं करिए सर, खत्म हो रहा है. There. So I will keep dipping my side port to keep the IOP in control. So if you keep dipping the side port, you can actually use this second instrument to थोड़ा सा ऐसे रखेंगे सर. लाइट को देखेंगे सर. सर ऐसे कर लीजिए, एक जगह पे टिका लीजिए. हाँ, वेरी गुड. हाँ, dip the side port. Now the side port dipping acts like a valve and doesn't let the IOP go up. There. The surgery is practically over, so it's absolutely a bloodless surgery. So we learned how to operate a post-filtering surgery patient of glaucoma. Also observe the D-flip technique. Now I'll be using an Investa IOL. Ensure that we remove a very meticulous amount of viscoelastic removal is required in such cases, especially post filtering or glaucoma surgeries, because we don't want any IOP to go up. And there I try and place the haptic optic junction at approximately 180 degrees so that the loop comes at 30 degrees, so that the chances of dysphotopsia are minimal. सर जी बहुत अच्छा हो गया सर आपका. Again, dip the side port while removing viscoelastic. Does two things for you: creates turbulence, good amount of fluid turnaround. So the viscoelastic is being removed by two methods, one by vacuum of the IA port and second is by the egress of fluid through the side port. It hastens the surgical procedure, may ensure that there is no increase of intraocular pressure. Surgery is gone off 100% as desired. सर जी बहुत अच्छा हो गया सर आपका. Never leave very high intraocular pressure, slightly hypotonic.